Now in the second section, we will talk about the two other conditions, which will be the laryngeal diphtheria and how we diagnose laryngeal diphtheria and how we treat laryngeal diphtheria. And also we talk about edema of the larynx. Edema is the swelling of the larynx due to what are the causes that can cause swelling or edema. So laryngeal diphtheria. Laryngeal diphtheria is usually secondary to facial diphtheria, affects children below 10 years. The pathology of laryngeal diphtheria affects due to formation of tough pseudomembrane is formed in this that produce different features are associated with laryngeal diphtheria, which can form in the larynx and trachea and also can cause complete obstruction of the airway. So in the diphtheria, laryngeal diphtheria, there is formation of the membrane over the trachea and the larynx, and it can cause complete obstruction of the airway also. Usually it's common in children less than 10 years, and it is secondary to facial diphtheria. Exotoxin liberated by the bacteria, by the Corynebacterium bacteria that also produce the symptoms, and which include myocarditis and various neurological complications. So the infection caused by Corynebacterium diphtheria, which leads to the formation of the membrane, and they also produce an exotoxin, and this toxin produced by the diphtheria, Corynebacterium diphtheria, also produce the effects like myocarditis, which is the muscle layer of the heart that is affected in this. So it's a serious condition, should be differentiated or should be diagnosed early. So it should not be confused with acute membranous type of laryngitis caused by different other infections, because this can cause complications like neurological complications and myocarditis. Clinical features are low-grade fever, sore throat and malaise, toxemic with tachycardia and thready pulse. Patient is toxemic because of the toxin produced, and they have tachycardia, means very fast pulse, and thready pulse. So when you take the pulse of the patient, you see that it is fast and it's very weak and thready. It's hard to feel the pulse. Croupy cough, grayish white membrane is present on the tonsils. Inspiratory stridor and dyspnea, so there is sound produced on inspiration, inhalation because of narrowing or obstruction. And there is also cervical lymphadenopathy, enlargement of the cervical lymph nodes. Diagnosis and treatment confirmed by the smear, and the culture is important. In the culture you will find it's Corynebacterium diphtheria. Treatment is the diphtheria antitoxin to destroy the exotoxin produced, antibiotics like benzyl penicillin, maintenance of airway, tracheostomy, and complete bed rest. These are some treatment options for the patient with the diphtheria. Complications, as I mentioned already, myocarditis, which is the muscle of the heart, myocardium, muscle of the heart is infected or inflamed. So there is asphyxia. Death due to airway obstruction, toxic myocarditis and circulatory failure, palatal paralysis with nasal regurgitation, laryngeal paralysis and pharyngeal paralysis. So diphtheria, laryngitis can cause serious complications. So proper diagnosis, management by the especially by the culture that cultures the Corynebacterium diphtheriae is required, so we can do the antitoxin management and also so we can prevent the complications that are associated with membranous membrane formation, especially when it causes complete obstruction of the airway and cause complications like myocarditis. Edema of the larynx, another condition I want to discuss here is often termed edema glottidis in the past. It involves the supraglottic and subglottic region where laryngeal mucosa is loose. So this condition is mainly caused in the supraglottic and subglottic region where the mucosa is loose. When the mucosa is loose, it will have more ability to swell and accumulate the fluid and lead to edema. Causes infections like acute epiglottitis, laryngotracheobronchitis, tuberculosis or syphilis of the larynx, infection in neighborhood Ludwig's angina, trauma which can be surgery of the tongue and laryngeal trauma, foreign body endoscopy, some neoplasm like cancer of the larynx or laryngopharynx, allergy, angioneurotic edema or anaphylaxis, radiation for cancer of larynx or pharynx, systemic diseases like nephritis, heart failure, and myxedema. All these are different causes of edema of the larynx, which involve the supraglottic, subglottal region where mucosa is loose. And as a result of all these conditions, when there is infection or inflammation around the larynx, it can cause edema or swelling of the larynx. So many causes, all these are very common. We already discussed about epiglottitis, laryngotracheobronchitis, tuberculosis, syphilis. We will discuss later on in this lecture also. And then some traumas like any foreign body procedure in which we do endoscopy that can cause trauma. Neoplasm, different allergies can cause swelling or especially severe allergic reaction or anaphylactic reaction to some drugs can cause laryngeal edema also. Symptoms and signs are the stridor on inhalation or inspiration. Airway obstruction again depend on how the management of the airway obstruction will depend on degree of severity of respiratory distress. If it's severe, the tracheostomy is required to maintain the airway. Then indirect laryngoscopy shows edema of supraglottic or subglottic region, and in children direct laryngoscopy is performed. In children usually they are not very cooperative, so indirect laryngoscopy is not usually done in the children, and in children direct laryngoscopy is performed. Treatment is the intubation of the larynx, tracheostomy in which the hole is made in the trachea to ease the breathing, injection of adrenaline, steroids. So different treatment options are used depending on how severe is the condition. So that was all about the diphtheria of the larynx and edema of the larynx. Thank you for watching sqadia.com.